Migraine is a neurological condition that may cause a throbbing or pulsating headache on one side of the head or both sides. The pain can be moderate or severe and usually gets worse with physical activity. The headache may come with the symptoms like feeling sick or increased sensitivity to light and sound. The number of migraine attacks is different between people. One person may get a migraine headache once a year, and the other may get that several times a week. The headaches last from 4 hours to days or even weeks. Migraines run in families, so people with a family background are more prone to migraines. Also, the number of women who get migraine headaches is more than men. This is because of the influence of female hormones. The exact cause of migraine headaches is not yet known. These types of headaches seem to be associated with some changes in the blood vessels and nerves in the brain or the release of inflammatory factors. The triggers of migraines vary from person to person. They generally include making changes in daily routines such as changing sleep patterns, eating habits, or exercise. Delaying or missing a meal, too much or withdrawal from caffeine, or drinking alcohol. Foods containing theramine, like aged, fermented, or pickled foods. Food additives or preservatives. Cold or frozen foods. Bright lights like sunlight or light from screens. Loud noises. Weather changes like changes in altitude, humidity, temperature, or barometric pressure. Smoke or strong smells like perfumes. Medications like some types of contraceptive pills, some sleeping medications, or overuse of painkillers. The emotions like stress, anxiety, or excitement. They cause the release of some chemicals in the brain and may start or worsen the headaches. Some women experience migraine around the time of their menstrual periods. This type of headache is mostly caused by a change in the level of estrogen hormone. In some women, migraine attacks are associated with pregnancy or menopause. Migraine headaches develop in 4 phases, and each stage comes with different symptoms. These symptoms may not be seen in all people, and each person can experience the symptoms with different severity. The first stage of a migraine headache lasts for about a few hours or days before the attack. The mood, behavior, or appetite may change in this stage. The second stage comes with an aura that lasts around 5 to 60 minutes. Next, the headache stage is experienced with pulsating pain on one side of the head that lasts about 4 to 72 hours. Other symptoms such as vomiting or sensitivity to light and sound can be experienced in this phase. In the final stage, the headache and other symptoms have almost improved. Symptoms like tiredness or depression can be experienced and may last about a few days. There are several types of migraines. The most common types are migraine without aura and migraine with aura. The rare types include migraine with brainstem aura, ocular migraine, hemiplegic migraine, abdominal migraine, and vestibular migraine. Migraine without aura is also called common migraine or episodic migraine. This type of headache starts without warning signs. The symptoms include pulsating or throbbing pain on one side of the head, nausea, vomiting, or sensitivity to light and sound. Migraine with aura or complicated migraine happens with warning signs mostly before the migraine headache begins. Fewer people with migraine headaches experience having an aura. An aura refers to the symptoms that usually begin about 30 to 60 minutes before the start of a headache attack. An aura can last from 5 to 60 minutes. It may be experienced with visual problems like seeing blind or bright spots, wavy or zigzag lines, or flashing lights. Sometimes it comes with temporary vision loss, foggy or double vision. Other symptoms include sensory problems, moving problems, speaking problems, hearing problems, changes in taste or smell, or vertigo. Alice in Wonderland is a rare form of the aura which comes with perception distortions, like a feeling of change in body size or time speed. Migraine with brainstem aura is a rare form of migraine with aura that is experienced with pain in the back of the head. In silent migraine, an aura and other symptoms are experienced while there is no headache. Status migrainosus is a severe headache that lasts for more than 72 hours. Retinal migraine comes with vision problems like seeing flashes of light and partial or total temporary blindness only in one eye. In hemiplegic migraine, one side of the body becomes temporarily paralyzed or extremely weak. Confusion or dizziness may be experienced in this type of migraine. Abdominal migraine is mostly seen in children and usually comes with no headache. The main symptoms include abdominal pain, nausea, or vomiting. Vestibular migraine usually causes dizziness or imbalance. Migraine attacks can be chronic or episodic. Chronic migraine occurs at least 15 days per month for 3 months or more. Episodic migraine is a type of migraine experienced up to 14 days a month. Migraine headaches may get worse if they are not treated, so it is very important to manage them. Consult your healthcare provider to choose a treatment plan right for you.